Okay, we're going to test this patient's range of motion in lateral flexion, both to the left and to the right side. So some compensations we want to be looking out for is if this patient starts to rotate when they laterally flex, or if they flex forward when they're in the process of lateral flexion. So the landmarks we want to look out for, we want to look for S2, which is right between the PSIS. You find the PSIS and go right in the center of that, and C7. So S2 is going to be our fulcrum, our moving arm is going to be pointed right towards C7, and our stationary arm is going to be perpendicular to the floor. Now the patient's going to be in standing and have their hands right along the side of their legs. Now can you drag your right hand down your right leg, please, as far as you can comfortably? Good. Now pointing that at C7, we got 45 degrees of lateral flexion to the right. And now we're going to realign here. Realign with S2. And have them do the same thing to the left. So can you drag that left hand down your left leg, please? Put that at C7. So there we got 43 degrees. So it's 45 to the right, 43 to the left. Okay, so now we're going to test this patient's trunk flexion in a manual muscle test. So the patient's going to be supine, preferably on a PT table. And we're going to start with a grade of 5. So the patient is going to have their arms behind their head, doing their best not to pull on the back of their head, just having them back there. And then we're going to have them just sit up as much as they can, looking for clearance of the inferior border of the scapula. Perfect. So that would be a grade of a 5. If the patient needed it, we could stabilize the legs if we needed to, but she was able to do it just fine. If the patient was unable to get a 5, we would test a 4, which the patient would just have their arms crossed like this and do the same thing. Just go ahead and sit up, clearing the inferior border of the scapula. Good, come back down. If the patient was unable to do that, we'd have them put their arms at their side, and this would be for the grade of a 3, and just do the same thing. Sit all the way up, clearing the inferior border, good, and go back down. Now if the patient was unable to do that, a 2 would be their arms at their side, and all they would get is a little bit of cervical flexion, but the inferior border of the scapula does not clear the table. And if that was still not happening, a 1 would be no motion happening, but you can feel a contraction of the rectus abdominis and the internal obliques, which are innervated by the intercostal nerves of T7 to T12.